outset want to acknowledge that today many scientists across the country and across the world are actually striking and halting their research activities to take an opportunity to educate themselves about the role of racism in STEM in particular and in academia more broadly, and to think about the role of anti-racism in our research and scholarship and teaching. And so I think this is a really important issue to start our discussion with today. And my understanding is that this is just the first of your webinars that you're planning on the public health response to the COVID pandemic, and that you're also in conversation with some of my co-authors and some of my colleagues who are really specifically looking at the issue of structural racism and interpersonal racism in defining how this pandemic has affected our country, our communities, how it has had a particularly devastating impact on communities of color, and especially Black communities and Native American communities in this country, and also how it is affecting our response to the crisis as well, how those forms of bias have shaped the response. You know, pandemics are deeply social events. We tend to focus a lot on the biomedical aspects of pandemic prevention and response, and those are important, but we know that just like any other public health threat, infectious disease threats, particularly when they're spreading rapidly and when there's a novel threat like the coronavirus pandemic, they really tend to move along the social and economic and racial injustice fault lines in our society. And we have seen that maybe more so with this pandemic than some past pandemics that have been experienced in this country, at least. I haven't really seen much discussion of similar effects with the 1918 influenza pandemic, for example. I think our society in the last 100 years has continued to develop in ways that continue to segregate, to separate, to underfund institutions, particularly congregate settings that result in increased exposure and increased risk for people from low-income families and households, for people of color. And those congregate settings range from nursing homes, which are one of the most racially segregated settings in our healthcare system, to prisons, jails, detention centers, which have obvious connections to racist structures in our criminal justice system and in immigration enforcement, and also to food production and factories and meatpacking plants. You know, across the board, we're seeing residents and disempowered workers in these congregate settings facing increased risk. Compounding that, we're talking about a virus that appears to dramatically affect people who have underlying chronic conditions, and those chronic conditions, heart disease and lung disease and others that themselves are very much affected by structural racism and by interpersonal racism and economic means that are available in communities and households and to individuals. We tend to talk a lot about some of the environmental components of that, things like air pollution as a result of environmentally racist practices, and in terms of where residences are sited, where sources of pollution are located. We tend to talk about it in terms of food injustice and access to the resources that are needed to support healthy living. But I also think we shouldn't discount the impact of the everyday experience of interpersonal and structural racism on psychosocial health. And that psychosocial stress itself is a contributor, a significant contributor to the chronic diseases that we're seeing compound that COVID risk. So there are just a multitude of ways in which the risk of severe COVID disease and death from COVID are interacting with structural racism, with interpersonal racism in our system, within the healthcare system and far beyond it.
Absolutely. Thank you so much for that. I think what you highlighted very nicely also was sort of this tension or difference between population health standards and outcomes, as well as the individual person. And I wonder, in that same light, in many ways, public health and public health law has this sort of challenge of balancing the collective population health outcomes, or if you want to think about it as the common good with individual civil liberties. And I want to talk a little bit more about that. How has the tension really between public health interventions and the civil liberties played out really in some of the court challenges to, for instance, the coronavirus emergency orders? Can you think of ways that there might be some noteworthy occurrences, and moving forward, how has this really, or how do you imagine this to be impacting the realm of public health law?
Mm-hmm. So I think this has been something that's really dominated the legal discussion about the coronavirus pandemic and our responses to it. I just want to say at the outset that while it is accurate to say that there's this tension between the common good and respect for individual liberties, one of the lessons that we've learned from past pandemics, particularly the HIV pandemic, is that in some ways respect for individual liberties can actually be a part of the public health response. So privacy protections, anti-discrimination protections can help support healthy behaviors by encouraging people to, for example, get tested. You know, one phenomenon we're seeing now is that as testing becomes more available, there's actually a concern that people are staying away from testing for a variety of reasons, including the stigma that they might experience. And so I just want to put a pin in that at the outset. But that doesn't mean that there aren't significant tensions between civil liberties and the public health response. We've seen that playing out in the courts. One thing that it's really tough to convey is just how little law there really was to guide the social distancing response to the coronavirus pandemic. You know, we had quite a lot of legal development over the last century or so, especially within the last 40 years or so, around individual quarantine and isolation orders. And some of that was actually influenced by the threat that those may be used in the face of HIV risk. And so there was quite a lot of reform and discussion about how civil liberties could be protected in that context of individually targeted interventions like quarantine and isolation. We tend to use the term quarantine, or a term that I really hate, lockdown, to describe the interventions, the emergency orders that were adopted in response to the coronavirus pandemic. I think it's actually really important to separate out the specific things that were being ordered, the specific restrictions for the purposes of assessing their legality and for the purposes of assessing their efficacy and from an ethical standpoint as well. So if we look at orders mandating that the general population stay at home, orders mandating that people in the general population, regardless of whether they're reasonably suspected of being infected or exposed, to maintain physical distance while out and about, orders to wear masks out in public, orders to close businesses, and not just the kind of standard places where people tend to congregate in mass gatherings indoors, but in many jurisdictions, all non-essential on-site business was prohibited, whether open to the public or not, whether it could be carried out safely or not. So these orders really went significantly beyond what had been recommended or envisioned in most pre-pandemic plans for social distancing. Even aside from that, we had really zero court orders on what business closures in this kind of setting, how they would be reviewed by the courts. Now we have a growing body of judicial opinions, and I think that is actually quite helpful. I think it can inform the next wave of executive orders, whether that might be in response to future outbreaks or flare-ups of coronavirus, or in response to another epidemic threat in the future. It can also inform legislative reform efforts, particularly at the state and local level, where there are relatively detailed authorities governing things like isolation and quarantine orders for individuals, but really very little in the way of statutory guardrails for social distancing in the general population and the use of that by executives. One of the things that we've learned is that many judges are eager to find kind of a bright line framework for upholding, for granting wide deference to executive orders in the context of an emergency. So early in the crisis, particularly in a series of cases about restrictions on abortion, we saw a series of courts, including 2 circuit courts, adopt what my co-author Steve Vladek and I have referred to as a suspension approach, which is really not in keeping with the vast majority of constitutional doctrine in this country. It is an approach that's used outside the US, but important to note that when suspension is explicitly adopted outside the US, it usually is subject to procedural safeguards, such as endorsement by the legislature being required. And so it really isn't a very good fit with our constitutional system to explicitly endorse suspension of civil liberties altogether, as opposed to deference. We've seen courts use a very old decision that has suddenly gotten a lot of attention outside of public health law circles, where it's always been near and dear to our hearts, and that's Jacobson v. Massachusetts, the 1915 case about smallpox vaccination mandates in the city of Cambridge. So we've seen courts adopt Jacobson's standard, which really predates modern constitutional understandings of the 14th Amendment, the First Amendment as applied to the states, and adopts this. It was really one of the earliest articulations of any standard of review under the 14th Amendment's Due Process Clause and Equal Protection Clause. And courts, a handful of courts, used Jacobson to kind of disregard all of that more recent doctrine. Helpfully, we had a pair of opinions from Supreme Court justices recently in a decision to deny an injunction out of California in a case called South Bay United. Justice Kavanaugh wrote a dissent from that decision in which he adopted the view that many courts have adopted, that these restrictions on church services are discriminatory on their face and therefore subject to strict scrutiny, even under the Smith opinion, which really relegated to rational basis review most kinds of generally applicable public health and safety regulations. Justice Roberts issued a concurrence, offered a concurring opinion in that decision, in which he cited Jacobson for its more common, more general principles that deference is warranted, that judges should not substitute their own policy judgments for those of the elected branches, particularly under conditions of scientific uncertainty. That's really the way I've taught Jacobson for my entire career. It's the way I learned it as a student, not as an emergency powers suspension standard of review. He therefore sort of endorsed the idea of deference, but not suspension. And I think that's the right approach. And then we've seen several district courts and circuit courts taking a less deferential stance as emergency orders wear on. We've seen that in part, I think, because the longer these restrictions are in place, the less deferential courts are likely to be, the more they're likely to view the restrictions as inappropriately encroaching on individual rights and freedom. I think another factor is that many of the decisions we've seen recently that have either struck down emergency orders, as we saw in Maryville Baptist, a case out of the Sixth Circuit, or narrowly upheld them, as we saw out of a case on a traveler's quarantine in Maine recently. In those cases, I think it's also a factor that the governor had already issued, or the executive had already issued a decision saying, like, this order will expire soon, right? So in Maryville Baptist, the Sixth Circuit specifically mentioned that that the governor had said that in-person church services could resume within a matter of a couple of weeks, and so it's sort of may be seen as a lower stakes environment for a court to weigh in. I think that's helpful. Again, I think. If courts don't articulate any meaningful guidance about how to balance civil liberties against public health intervention in these kind of settings, we're left in the same situation that we were in before the coronavirus pandemic, where we really are just guessing at how courts will review these orders. I published an op-ed shortly after the Bay Area orders, the first stay-at-home orders were issued in the U.S. And that I didn't give the headline, but the headline assigned to it was "The coronavirus lawsuits are coming," and that's not a bad thing. I stand by that. I think it's been a fraught process, but I think it's been helpful to get this guidance to inform subsequent orders and legal reform efforts.
Great, thank you for clarifying that. how have these tensions between some of the governors and the state legislators really affected this response to this pandemic? You mentioned about the tensions between the governors and the federal government and the states, especially if you can address some of the social distancing measures and who wields the authority for that. And this reference we speak about to social or the norms, is that something you see as being sustainable moving forward, or has the president largely stayed within these bounds of his authority, or has he, in your opinion, overstepped them?
Yeah, so we talked a bit about civil liberties constraints on public health interventions. We're actually seeing that structural constraints based on the which government actor meaning have been in some ways more successful than the civil liberties challenges, or certainly more numerous in recent weeks. There are multiple issues at play here. There's the separation of powers constraints on state executives vis-a-vis the state legislature. We've also seen that there are constraints in terms of local government authority that has been preempted by the state government in some states. And this has really, there have just been a series of conflicts over who holds the reins on social distancing. Moving to the federal-state relationship, we've also seen a series of, really I think they can only be described as threats from the president to intervene. I got a lot of calls over the last few months from journalists essentially boiling down to, can he do that? Can he do this thing that he's saying that he's going to do? I did something really uncharacteristic for a law professor in an early podcast. I uttered the words, definitely not, as opposed to it depends. And they led with that. So the first two words you hear before I'm even introduced are just definitely not. That's a really dangerous thing to say, but the president's authority is very limited here. The federal government through Congress could certainly take steps to preempt state authority on the grounds that these orders interfere with interstate commerce. They could also condition spending, which would be an even easier approach. That I think would have been challenged, but more importantly, there's really no indication that Congress ever intended to do that. What we saw was the president feeling very frustrated. State responses in a variety of ways over the course of these orders being imposed, particularly in March and into April, and threats that he had authority, that he had absolute authority, that he was going to declare, that he was going to direct Attorney General Barr to sue the state and local governments. And now we see the same thing, the same kinds of threats with respect to withdrawing from WHO unilaterally, which he probably does not have authority to do on his own. Again, something that Congress could get involved in. There are also time limits that would apply. And we've also seen it with respect to the steps that state and local governments have taken to intervene and quell protests. And his threatening language there, that the federal government would step in. More than threats in DC, at least, where the National Guard was deployed from states outside of the district. So lots of big talk. I think there have been some actual actions that have been taken by the federal government. One is the Department of Justice has filed statements in several cases that were filed by private parties. The effect that those have had is subject to debate. Some of those cases, the plaintiffs have lost, some of them the plaintiffs have won. It's possible that judges find it compelling when the Department of Justice weighs in favor of challengers to social distancing. But I think in large part, we've seen a lot more bark than bite in terms of federal overstep. The biggest problem with the federal government's role has actually been abdication of federal responsibility. On the flip side, so states really hold the reins on social distancing, but the federal government is really, I argue, the sole actor in this country with the resources, because it can deficit spend, whereas states are constitutionally prohibited under their state constitutions from deficit spending, and with the interstate coordinating authority, because state interstate compacts can only go so far, to ensure the resources required for things like a massive rollout of testing and tracing. for things like supports to enable people to follow public health advice by providing them with legal protections, by providing them with income support and other things that are needed for them to be able to make the healthy choice, the easy choice. The federal government has really abdicated that responsibility. It was really stunning as someone who works in public health law and public health preparedness to hear Jared Kushner take the stage and declare, that stockpile isn't the state stockpile, it's our stockpile. I think one of the most insightful commentaries I saw on that was a tweet, and I unfortunately cannot remember who wrote it, but a tweet that said, "Why does it feel like the federal government is seceding from the union?" I think that that has been the issue more so than actual federal overstep. Interestingly, though, early on we saw real demands for a nationally uniform social distancing response. I think it's important to point out that guidelines are helpful. So I've been writing about the role that CDC guidelines play in giving state and local governments cover, for example, in defending their restrictions in court. And that has really been inconsistent and absent. We had conflicting White House and CDC guidelines. But my view, at least, nationally uniform restrictions are really not an appropriate or needed response, that states hold the reins on social distancing, and that is as it should be from a public health perspective. Conditions vary from place to place, and restrictions should vary in response to that.